As a consultant, I go into practices, and some of the things that I look at and before I walk into the practices, their websites and what do they have available. And quite often what I see is, there's a button that says services, and I drop that down, and then there's surgery, and there's acupuncture, and then there's dental care. And when I click on dental care, often there's 2 paragraphs. Basically what that's saying is that we're expecting that all the information that a client needs to know about dental care is going to be able to be summed up in 2 paragraphs. Yeah, it's not able to be done that way. As far as marketing, I think a couple things are important. First of all, it needs to be a full hospital team effort. It can't just be solely on the doctor's shoulders to have to do this promotion. I think the other thing that needs to be done is much earlier. When I poll many of my audiences when I'm speaking, the average at this point, they're saying 5 to 7 years is the first time they're expecting an animal to be on the table. And often then they're getting into extractions and they're having these long protracted anesthetic events. So I think if we're starting to talk about it at the age of 2 on some of these dogs, we can start to provide more prophylactic care and get a good baseline of x-rays, and then see if we can get them in on an annual basis. And if they're hearing this message repeatedly, then we have a rule of 7 in marketing, and that rule of 7 says is that somebody needs to hear the message 7 times before they really even hear it. And so if we leave it to the doctor to start at 5 years and say it for the first time, I think we shouldn't be so surprised that it's not until they're 10 or 11 years old before they're on the table and needing 3 hours of dentistry. So I think we should be talking about it much sooner.